Hi, this is Dr. MuragijeYesu again from Dr. Mura Health, and in this free Beating Type 2 Diabetes Health Challenge. We hope you've been enjoying this so far. This is day number 3, and as we go through things, we started getting a little bit easier and easier as we now started talking about the true solution for this problem. Day 1, we did highlight really how our body physiology works and how where the problem starts. We talked a little bit about type 1 and then type 2, and then we really got to the root cause of this problem, which is intramyocellular lipid that fatness in the muscle cell in the liver that is rendering insulin not responding, the muscle not respond to the insulin, and then rendering the sugar being higher up. Day 2, we did talk about a little bit more the treatment or the complication, the treatment that are commonly used, and why these treatments are not often, they don't really take away the complications that happen. Yes, there is a room for treatment by all means, but no one should be on a medication for the rest of their lives, because remember, these treatments are not geared to be able to go and tackle the root cause of type 2 diabetes. Now, today we're going to be talking about, so we talk about the treatment, that are the drugs, how they work a little bit, and we're going to touch on slightly a little bit on them again today. But today, what about some diets? One of the key diets that is often spoken about is keto diet. Even in our hospitals, when you check the kind of diet that are given to diabetic patients or even hypertensive patients, it seems to go around more like a keto diet. The diet that is basically trying to minimize or reduce or completely just avoid carbohydrates. And we see how it seems to give a little bit of false results, and why people seem to think it works. But anyway, one of the reasons why the sugar may seem to be a little bit lower is because, by the way, any diet or anything that you can do to lose weight, you're gonna reverse your type 2 diabetes. Yeah, I say that. You know why? Because any diet that is gonna make you lose fat is gonna help you to increase that muscular sensitivity. Insulin is going to open up, and that is why, for example, if you by all means, God forbid, you have a cancer and you are undergoing to chemotherapy or radiotherapy, what happens is, because of the toxicity of the chemo, you're going to lose weight, and then once you lose weight, you're going to lose fat, and that fat started coming out, your muscle come to be sensitive to insulin, and then your blood sugar can just normalize, and you can be offered, type 2 diabetes. Other thing, of course, yesterday we talked about is if you limit how much food you eat, basically your sugar in the blood can actually become lower and lower. Remember gastric bypass that we talked about in our previous video? That can happen. But not only that, we know since 1870s that type 2 can actually be reversed by just restricting food. There was a siege in Paris where people went extremely low calories, they were not eating, and their type 2 diabetes disappeared. We know that. And also, we know if you can really lose up to 1/5 of your weight, you can actually be able to increase insulin sensitivity. You know why? Because the more weight you lose, the more the fat coming out of the muscles, out of your liver, and then the more insulin started getting sensitive, and then you don't have to secrete too much insulin, and then your blood sugar is just in a normal range. Now, the problem is though, like I was saying, the way we in the hospital, we don't say go to keto diet, but what you see, what they recommend is no carb, low starch, and so forth. And we're gonna see tomorrow. Actually, we're going to see why the confusion and what's up with the low carb and the starches. We're gonna see. But today we're just gonna talk about keto diet, because many people are on this diet where if they want to lose weight, if they want to be able to reduce amount of, even for treatment of diabetes. In fact, there is a diabetes support group that really just a keto diet. And it's so dangerous. Please, by any means, if you can just understand how this works, today, if you're on a keto diet, you should stop. Literally, you should stop. And that's all. If I can be able to convince you to stop in this meeting, I will have done my job. Like I mentioned, we know already from 1927, the studies that I alluded to in the first video, that when they challenged people, that study was separated and the medical students in 2 groups. One were fed high diet, a high fat diet. Other group was fed high carbohydrate diet. And then after 2 days, when they were challenged with the glucose, the high fat diet failed the glucose tolerance test. That is, the blood sugar in the blood shoot up, and which means the insulin sensitivity was not working. In 1921, one of the physicians at Mayo Clinic came up with this idea of putting people on a low, carb diet, hoping that was going to be able to help with the obesity and also hopefully diabetes. The keto diet has been helpful in a patient that have epilepsy, in kids with epilepsy, but now they wanted to see can it work also in losing weight and also in a patient that are diabetic. Remember, carbohydrates is the primary fuel of our body. So by removing carbohydrates from your diet, you're forcing the body to start burning fat, right? That's what seemed to happen at the first. You started burning fat. But then what happened, the problem though, when you started burning some fat, remember on a keto diet, you're eating also high protein, high fat diet. So as much as you may seem to be losing fat, you're also increasing the consumption of fat that you're using. Not only that, when the body is starving from having carbohydrates, the primary fuel of the body, what it does, it starts breaking down your protein, the muscles, so they can be converted, which is a longer process, by the way, converted into glucose, into energy that the body can use. On a keto diet, that low carb, high fat diet, what happens is, number one, you are going to lose water. Okay, that's what happens. So people in a very short period of time, you can just lose water and you feel, wow, I'm losing weight. On the scale, everything seems fine. Remember, on high-fat, low-carb diet, there is almost not a much of water, because when you go to high-carb diet or plant-based diet, so to speak, actually 80% of that food is full of water. And then you have basically water that is full of water. Now, when you're completely changing, you're eating food that is devoid not only water, devoid other macronutrients. In fact, they found that people on a keto diet, they have almost 17 macronutrients that are deficient, because remember, you're moving all main low carbohydrates, the phytochemicals, all the minerals like selenium and so forth. There is some deficiency that a patient that are on a high keto diet, they start developing. So on the outside, things may start looking better, but inside, actually, remember, at the very first, you see that you're losing some weight, water rushing out of the body. You can actually lose much weight and think, wow, this is the way to go. But as you continue eating high-fat diet, then you actually replenish your fatty cells of fat that basically, as much as you think you're losing weight, what are you losing? It's the water, is the muscles. And I'm going to show some literature on this so that you can understand. There is actually a study that was done. Remember when I talk about the more insulin, the more you gain weight and so forth. So the study there was actually this journalist who came up with this. It was talking about the insulin model in diabetes and so forth. That is saying that the fat is a problem is actually a lie. So what happened is he confused the symptoms of diabetes with the root cause of it. Now what he did, some of the scientists that he quoted in New York Times magazine, by the way, actually disproves what he said. Now, because he was very adamant to check, really to say that a low carb, high fat diet can actually help you lose weight and also treat a certain condition, he managed to gather some funding to be able to do the research. So what they did is they put 17 men, right? They locked them in a room so that the scientists can actually determine which food they eat and how much carbohydrates, how much fat they eat. So for 2 months, the very first month, what they did, they put them on a high carb diet, normal diet. Okay, now what they did, if you go on the actually high carb diet, what happened is when they start, of course, they making sure that it has a protein and many other things, just albeit being plant-based. What happened is they were losing about half a kilogram a week of their weight. But on the second month, when they shifted them to the high-fat, low-carb diet, they started losing a lot of weight. They lost up to 1.5 kilograms in a week. Now, wow, that was like, wow, they're losing a lot of weight. But then when they started to see the fat, to see how much fat they actually lost, in the first week when they were on high-carb diet or carbohydrate diet, the fat were being burned, they started losing fat. But on high-fat diet, the loss of the fat, the burning of the fat started slowing down. That study, of course, was thrown away and they stopped. And they claims that one can actually lose fat on high-fat, low-carb diet. It's out the window. Anyway, we knew that for a while in scientific literature. It's just what they wanted to prove. They want to prove actually that this claim is actually a false. Now, when you go to keto diet though, what happened is, remember, you take away carbohydrates, like I mentioned. I did show you, remember when I was showing you on the board, talking about how our body uses carbohydrates, how the sugar goes into the blood and so forth, and the insulin to open up and take it to where it needs to be used. Now, when you removing carbohydrate completely, this is analogy that I already use, and hopefully it's going to make much sense. All right. Now, think of a tap of water in the sink in your house, right? Suppose basically open the tap, okay? If the sink is open and everything's fine, no matter how you're gonna open the tap completely full, the water is just gonna go down, no problem. Yes or no? Yes, because that's how it is supposed to be, okay? Now, but suppose, now what you started doing, you started washing your hair into the sink, right? The hair going to into sink. You started shaving in there, you're lotioning there, the cream go into the sink. And then it's slowly, because the hair and there's so many other things, the oil, and then it started getting clogged. Now, what happens is though, in our conventional medical community, it can be clogged until water now starts spilling over. Remember, the whole sink now is, because the water is not going where it's supposed to be. Now the water is spilling over. So what we do in the medical community, instead of trying to find out what is clogging the sink, we take a mop and then we start mopping the floor. We keep mopping the floor. You want to mop the floor with the metformin. You want to by the way, in these other lifestyle diseases, you want to mop the floor with the statin. You want to mop the floor with some antihypertensive treatment, because these are the symptoms that we see. And then what I saw, remember the study that I shared yesterday, talking about how when you're trying to intensively lower your blood sugar, people actually end up dying. Now, what do we do when we see that, oh, the metformin it's not working? What do we do? Let's increase the amount. Okay, fine. Let's get a little bit of bigger mop so that there is no sugar on the floor. There's no water on the floor. Not only that, after that we realize maybe we need a plunge. That thing you plunge it to be unblock the sink. Then you put insulin, trying to push. Remember how I showed yesterday how insulin basically, even some drugs that are trying to release more insulin so that it can hopefully go and open up those receptors on the muscle cells and liver to be able to open up that insulin. So we plunge it in there to see if that can help. Remember, the more hair, the more the dead things in the sink, it's still blocked. Now, when you plunge so much, you can actually push so hard that the water, basically the pipe burst below the sink. And that's what happened when they put a patient that were diabetic onto more than about 5 different types of medication, some including insulin. They died. That's what happened. Just as you push so much, trying to unblock that sink with just too much force so that you cannot see the water. That's what happened when you just push too much medication trying to treat the symptoms. Now, what happened then, that is, here comes low carb diet. So you know what? Remember the water that is coming through the sink? Suppose that is glucose, carbohydrates, so to speak. The sink is full of water and it's spilling over because water. So what about the cut off water? Yeah, good idea. Fine. Let's cut off water then. So then you cut water, right? Remember there's no water coming. Yes, remember the sink was full of water already because when the sink is blocked, and they see the water is going so slowly that basically in the morning you left the sink full of water. When you come in the afternoon, then, oh, the sink is clear. They see the dirt on the sink so that's more the case. So let's close the water. Okay, now when you close the water, slow that sugar will start disappearing. And they say, hey, voila, there's no more sugar. So out of sight, out of mind. Now that is a problem. Literally, like my favorite evidence-based doctor talking about a keto diet. It's more like you have someone who have a pneumonia, a respiratory infection. You know, when you have that pneumonia, you have fever. Now, instead of trying to find out to find the real root cause of that pneumonia, a bacterial infection, you think, how can you quench this? How can we be able to take away the fever? So you take the patient, put the patient into the bank of snow. Yes, you may be able to take away the fever, but you may lose the patient as well with hypothermia. And this is what we're trying to do with the keto diet. Because you don't get a carbohydrate in, that seems okay, because you don't see the issue of the sugar. In fact, some low carb, high fat diet, the keto diet, they seem even to say that actually you started taking people off insulin just being on a keto diet. Again, the same principle. I wish you can understand the concept that I'm trying to show you with this analogy with the sink. Yes, the sugar is not there, not because you went into the sink and took all the debris, all the hair and so forth to unblock the sink. No, it is because the water is no longer coming. So we haven't really taken away the really root problem. It's like you have a painful finger and you want to just get away this finger, but they say, you know what, instead of finding out what's wrong with the finger, then you just cut off the whole arm. That's what a keto diet basically does. Now, the problem though with the keto diet is not only that. Remember, you're masking the problem. You think you're fine, but you're not. Remember, you're losing a lot of good stuff from really being a balanced, whole food, plant-based diet, of which we talk about, by the way, and show evidence how what the science talks about. But also, you start compromising your kidney. Remember what I was talking about atherosclerosis? In a keto diet, what is start happening is you're going to have, of course, it's high fat. Okay, with high fat, you're gonna start this basically you remember saturated fat that we talk about. Okay, remember this started building up, leading you to atherosclerosis. And with atherosclerosis, this leads to what? To hardening your arteries and causing ischemic heart disease, the issue of heart attack. Okay, heart disease. Okay, we're going to talk about it going into the stroke. The risk continue going up and up. That's the problem with the high fat diet. Not only that, people that are on high fat diet, there is what I mentioned yesterday. Remember when I talked about the issue of what happened in the eyes, the complications. There is what we call advanced glycated end product. That is that happens when high sugar is combined with the protein or combined with the fat. Now, what happened with those advanced glycated end product, they cause the vessel to be thickened, especially in small vessels, and also they start becoming leaky and leakier, causing blindness and so forth. Not only that though, if let's say in a high fat low carb diet, because now the sugar may not be high in the bloodstream, which is okay, but they're eating high cholesterol type of diet, they're eating high saturated fat diet, and also other thing that causes the issue of advanced glycated end product is if you prepare your meal like a grilled meat and so forth, or the frying food in high temperatures, those things can create advanced glycated end product as well. Now, in doing that though, yes, you don't see the sugar, but basically what is coming next is going to be those complications, the heart attack, the stroke, the kidney disease. That's what end up happening with the keto diet. Now, like I mentioned, you may seem to lose weight, okay, which is okay, by the way. That is why a high fat, low carb diet is often not sustainable. Remember when you start going on the ketones, you have that, what you call the bad breath. The kidneys started shutting down. Of course, your cholesterol was shooting up. Of course, the issue of vascular disease and the issues such as the erectile dysfunction as well started coming in. So it may seem okay now, but on a longer run, it's actually a disaster. And no one should be on high fat, high protein keto diet, because this is going to be worsening your diabetes. Definitely it's going to continue to render your muscles and your liver become a little bit more resistant to insulin. In doing that, the vicious cycle will continue again. The body will continue to try to create more insulin from beta cells, and then the beta cells of Langerhans are going to be depleted. And remember, you continue creating this amyloid deposit around the beta cells. You continue eating high saturated fats that are causing more issues. So again, I'm going to give you a bit of research. You can read more on this. But when it comes to keto diet, it's not good for your weight loss. if you, by all means, if you want to lose weight for 1 week, I guess go to keto diet, because you're going to lose all the water. You're going to start working on your muscles, losing your muscle. By the way, it has been shown in athletic people that are actually on a keto diet, when you measure their muscle cell, you can see the muscle cells started breaking down. They started losing their muscle mass because the body now started breaking down protein, trying to see if it can provide energy. And that is not the way to go. For a short period of time, I wouldn't recommend that. It's not healthy at any given time, but definitely not for diabetic, because it's going to actually worsen this problem. And the studies are shown. There was actually a study that were published in American Diabetic Association. A study reported a patient, a 51-year-old, I'm going to send you the study, a 51-year-old who was otherwise fine. By the way, he did a coronary angiography before starting on a keto diet. He felt like he's gaining a little bit of weight, so he thought maybe let me go to keto diet. So what did he do? He completely avoided carbohydrates. And then what happened, he started losing weight. Then he was amazed. But what happened about a year or so after, he did not have any erectile dysfunction before. He started having erectile dysfunction. And then the cholesterol almost doubled from where it was. And then he was like, maybe that's actually okay. When he went to the physician, I know cholesterol fine, then he gave some statin and so forth for his cholesterol. But then it happened that he nearly had a heart attack. When he checked, he went to the hospital, he found that his coronary arteries, one of the arteries supplying the heart, was clogged only 90%. Now, then what happened? And then remember, he had to go on a Viagra apparently, so that he can be able to deal with his erectile dysfunction. Of course, he was on a statin. Of course, the blood pressure also started going up. And then one may say, but maybe he had this coronary artery disease before. No, he did have scan before actually starting on this diet, and there was no evidence of clogging of the arteries. Now, after this, then this is one of the science how you can actually change things and see with the diet and see what happened. He changed his diet. He actually avoided this high-fat, low-carb diet. He went on plant-based diet. Then what happened is his erectile dysfunction got better. And not only that, his cholesterol came down. And then his arteries started, the clogged arteries started getting better. And from tomorrow, as I'm going to talk about a little bit more on whole food plant-based diet. I want to talk about the myths that people have about whole food plant-based diet. What about protein? What about carbohydrates? I want to talk about it a little bit specifically to understand how the confusion that is out there between simple sugars and the carbohydrates and so forth. But anyway, he managed to show how high-fat, low-carb diet is detrimental to your health. Please, by all means, it may seem okay now, but when you think physiologically what is actually going on, I hope my analogy of sink makes sense. Now, that is sink, remember, is clogged already. Now you just close the water. If you close the water, yes, you want to see the sugar, but the problem is still there. Remember, the evidence that really you have cured the type 2 diabetes, or rather you have reversed the type 2 diabetes, it's if people are challenged with the glucose, their glucose will be assimilated into the muscle and the liver and so forth, and when you check the glucose level should be normal. Remember what we talked about that. But the fact that if you challenge the high-fat, low-carb diet with the glucose, their glucose will shoot up to the roof, just like a sink, because you did not correct the root cause of problem in the sink, which is the hair and all the bad stuff that you've been putting in. Until you remove them, you haven't cured the problem. So let's not just follow the symptoms. Let's just try to go to the root cause of disease. And if you wanted to really tackle type 2 diabetes, we need to move the fat from the muscles, and that we need to make sure we lose that excess amount of fat. In doing that, we need to go what we call a whole food plant-based diet or low-fat diet, and I'm going to explain to you, and that's what we recommend in lifestyle medicine, really, because the evidence has been shown that the whole food plant-based diet, because it's low in fat, it has good carbohydrates, it has amount of protein that you need, it doesn't complicate the body, you're really going to lose weight, not just in 1 week and everything is gone, no, steadily but continuously, and then you're going to maintain it. And that should be what we should be preaching to our patient as medical doctors, because that has been actually shown to make a difference. By the way, now talking about type 2 diabetes, I know I'm going a little bit ahead of me for the talk tomorrow, but for example, the Canadian Diabetic Association recommend the whole food plant-based diet for diabetic because the evidence is overwhelming. If you wanted to really tackle this condition. And I think it makes sense because remember, when you eat a whole food plant-based diet, no processed food, no junk food, I'd say like a high fruit, vegetables, legumes, beans, lentils, split peas, and so forth, the herbs and spices and so forth, you literally start losing, shedding that fat away. Remember, your fat cells don't change, but you squeeze that fat out. Your abdominal start disappearing, and you're still looking better. You're going to have energy. And from tomorrow, with us, we'll start showing you the testimonies of people who went on Dr. Mura Health program, how they felt and how they are feeling today. You don't want to miss tomorrow. But please, by any means, if you're on a keto diet, I'm going to send you also all the references. If you're not convinced, please ask some questions. Keto diet is not meant for you to be on it. Just like all this other medication, if there is a problem, by all means, temporarily we can use a medication. But remember, on the long run, we need to go to the root source of the problem. And if you want to correct the root cause of type 2 diabetes, which is the insulin resistance, the problem is not carbohydrates. The problem is a fat that is a rendering. You must not to be sensitive to insulin. And that's why the sugar shoots up. If we correct that, we remove the fat, then the insulin started doing its job, and then we don't have the surge of glucose going throughout our body, causing all these complications that we mentioned, and that's the way we have to go. And I'm going to talk more about that tomorrow when I break down. And remember what I said, by the way, it will let us help you if you are type 2 diabetic and really wanted to go to the root cause. You're going to need some help. Now, why can't you sign up with us to that VIP? It's never too late. And then we can actually help you practically with the things that you can do. Thank you so much for watching, and I will see you tomorrow.